The Washington State Department of Health and the State Hospital Association recently announced the first Centers of Excellence for Perinatal Substance Use certification recipients. That includes 2 hospitals in Spokane and the University of Washington Medical Center Northwest in Seattle. That certificate recognizes hospitals that made significant progress in supporting parents and infants affected by substance use disorder. And Tyrah is in the ARC Lounge this morning with Lacy Fehrenbach, the Chief of Prevention, Safety, and Health at the State Department of Health. Ladies?
Thank you so much, Steve. This is such a critical topic, and thank you so much for coming in to talk about it.
I'm very honored to be here today. Thank you for the opportunity.
Of course, of course. Thanks for your time. So can you first just talk about what prompted the need for this specific type of certification?
Yes, well, along with the growing opioid crisis, we saw that behavioral health conditions like substance use disorder and overdoses were a factor in a significant portion of our pregnancy-related deaths. And we have a statewide maternal mortality review panel that looks at those and then makes recommendations for improvements that can prevent future deaths and improve care for all women who give birth in the state of Washington. So one of the recommendations they made was to increase both the access to care and specifically substance use disorder treatment for pregnant and parenting individuals and the quality of care. So that gets to making the care welcoming and free of stigma.
And so when you're talking about that care, obviously, you know, the care happens at different medical facilities. Can you talk about what separates those facilities apart, you know, who have obtained the certification? What's the difference?
Yes, those facilities have adopted national standards for the best clinical care, and they've trained their staff to provide that welcoming, non-stigmatizing environment. They have policies and procedures in place that really center the parent and recognize the parent's role in early child health for their newborn. They facilitate access to treatment for the family. They help give the parent skills for non-pharmacologic interventions that will help their newborn. And they link the family to community-based services and supports and treatment so that they're successful when they leave the hospital environment.
Wow. So back to the root issue, obviously a very widespread problem. You mentioned some of the data and the research. It sounds like a lot of people are affected by this. Can you talk about some of those unique needs that parents and infants affected by substance use disorder, what do they have? What are some of those needs?
First and foremost, any person with substance use disorder needs access to treatment.
Yeah.
And what many of them face is a lot of stigma and shame. And that's very unfortunate. Substance use disorder is a disease. It can be treated. It should be treated. People deserve treatment. Pregnant and parenting people face, I think, a different level of fear. There's a lot that new parents have to deal with. And there's fear of involvement in the child welfare system if you're substance involved. And a welcoming environment that is supportive of keeping parents together with their newborn when there's not a danger to the child, and supporting parents in helping their child to be comfortable using things like the Eat, Sleep, Console method really can make a huge difference both in the birth outcome for the pregnant person as well as their newborn.
Going back really quick before we go to the next question, you mentioned something about the stigma and stereotypes. What are some things we can all do as a society to sort of stop some of that stigma?
This is such an important thing that every person can do. The opioid crisis is everywhere. Probably every single one of us knows someone affected by substance use disorder. And the most important thing you can do is be there for them and support them and tell them that they deserve treatment and care and help them get access to care. There are resources on DOH's website that can help you find supportive care. Treatment truly saves lives and helps people improve their functioning in society. And everyone deserves that chance at health.
And more on that, what does treatment specifically look like, both for parents and infants?
For the pregnant person, it is usually a medication-assisted treatment. Things for opioid use disorder, it is usually buprenorphine or methadone, and the provider can adjust the dose over the course of pregnancy, birth, and during lactation to help the person stay in treatment and be successful in recovery. And for the newborn, there's a great advance around the method I talked about earlier, Eat, Sleep, Console. This is really comforting behaviors for the parent and newborn, things like swaddling, resting in a dark room, rooming in at the hospital right next to the parent, and breast or chest feeding. And not all of those things are things a parent can do without any medical intervention. They might need some skills to help and support from the hospital, but it significantly shortens the hospital stay time for newborns and sets them off on a great early life.
Eat, Sleep, Console.
Eat, Sleep, Console.
What are some things that people can do? Let's say they are struggling with substance abuse. Are there steps they can take before giving birth to help mitigate the risk to themselves and to the baby?
I think, the most important step is to understand that there's a care community that will support you, and that there are policies in our state and in facilities in our state, birth facilities in our state, that want to keep the infant with the parent anytime there's not an imminent harm risk to the newborn. And getting treatment will help you. It reduces the risk of overdose for the parent, and it also reduces the risk of preterm birth for the newborn. So getting treatment is like the #1 thing you should try to do, and embrace the supportive care that these centers are willing to provide. And hopefully we can have far fewer people in our state that are substance involved and families that are substance involved.
It's good to know that there are resources and support out there. Thank you so much for coming in and spreading awareness on this.
Thank you, Tara.
Steve?
Really important conversation. So many people impacted by substance use disorder. It's important to remember there are resources out there that you can help. Again, go to DOH's website if you'd like more information.